recently there were several trials, 5 big trials, who estimated whether it makes sense to give additional IV thrombolysis except to mechanical thrombectomy versus mechanical thrombectomy alone. So we took a look at that, and in this area of IVT plus MT versus MT alone, it's kind of a hot topic, and we wanted to see how does IV thrombolysis actually interact with delayed perfusion and persistent perfusion deficit, which we have been investigating. And based on our data, we couldn't actually see a correlation, a positive association between IV thrombolysis and delayed perfusion. We could see that there were different time metrics as opposed to when the IV thrombolysis was started, but overall, when we conglomerated all of the data, we couldn't actually see a positive association. There were trends that IVT promotes delayed perfusion, but it was non-significant. So in the end, we really couldn't establish a positive association between IV thrombolysis and delayed perfusion. But on the other hand, we did see some other factors which were associated with delayed perfusion. Those factors were the TICI scale, the reperfusion score, then the collateral score. So those patients who have better collaterals, they are more likely to develop delayed perfusion. Atrial fibrillation patients with atrial fibrillation are more likely to develop delayed perfusion. And also we'll take a look at the time between the angiography, so final angiography imaging, and the next day follow-up. So we call this angiography to follow-up time. And we saw the longer this angiography to follow-up time is, the higher the likelihood that the patients will experience delayed perfusion, which kind of makes sense because the longer you leave the vessels on their own without doing anything, there is a higher likelihood of observing this spontaneous recanalization.